When it comes to safeguarding our children's health, few topics are as polarizing and complex as the ongoing debate over COVID-19 vaccines. As schools across the United States reopen their doors, parents are caught in a whirlwind of conflicting guidance, with prominent medical organizations challenging the stance of Health and Human Services Secretary Robert F. Kennedy Jr. This clash raises important questions about who to trust and what's truly best for kids' health. And this is the part most people miss. The battle isn't just about science. It's also about communication and trust. At the heart of the issue lies a growing divide between federal health authorities and professional medical groups like the American Academy of Pediatrics, AAP. The AAP recently released updated guidelines on COVID-19 vaccinations for children, which differ from those issued by the Department of Health and Human Services, HHS. These discrepancies have left parents navigating a maze of recommendations, unsure of how to proceed. For instance, the Centers for Disease Control and Prevention, CDC, suggests shared decision-making between parents and pediatricians when considering whether to vaccinate children aged 6 months to 11 years who aren't immunocompromised. However, there's a catch. Last month, the Food and Drug Administration, FDA, granted full approval only to Moderna's vaccine, but exclusively for children with underlying health conditions. This creates a significant hurdle for families seeking protection for healthy kids. Meanwhile, the AAP advises shared decision-making for most children, but strongly recommends vaccination for specific at-risk groups, including unvaccinated individuals or those living with others vulnerable to severe illness from COVID-19. Adding another layer of complexity, the AAP maintains its own immunization schedule, which generally calls for 1 or more doses of the COVID-19 vaccine for all children older than 6 months. For overwhelmed parents trying to make sense of these mixed messages, Ulrich von Andrian, president of the American Association of Immunologists, emphasizes the importance of consulting a trusted healthcare provider. Parents should seek out personalized advice from professionals they trust, he explains, highlighting that clear, credible information is essential for informed choices. This conflict escalated earlier this year when Secretary Kennedy made headlines by aligning with the CDC's decision not to recommend routine COVID-19 shots for healthy children due to insufficient clinical data supporting annual immunizations. Critics quickly pointed out that Kennedy has long been skeptical of vaccines, even petitioning the FDA in 2021 to revoke emergency use authorizations for COVID-19 vaccines, during a time when thousands were losing their lives to the virus. But here's where it gets controversial. Kennedy's position mirrors global trends. Since 2022, major health bodies such as the World Health Organization, WHO, Canada's Vaccination Authority, and UK vaccination organizations have adopted similar stances, recommending against routine revaccination for healthy children, unless they have underlying health risks. Monique Johannan, a physician and senior fellow at the Independent Women nonprofit, argues that the AAP's recommendation places it at odds with international consensus. We were the only country pushing this vaccine for healthy kids. From my perspective, AAP is now an outlier regarding scientific alignment, she says. Johannan also voices concerns about the broader implications of this debate, particularly how it might influence parental attitudes toward other critical vaccines. She stresses the urgency of addressing declining vaccination rates for diseases like measles, which require high coverage levels to prevent outbreaks. As we enter back-to-school season, parents need to refocus on vaccines that protect entire communities, like the measles shot, she urges. Recent statistics show alarming gaps in measles immunity, especially in regions like West Texas, where nearly half of students were exempted from measles vaccinations during a recent outbreak. Supporters of the AAP's approach counter that their evidence-based recommendations reflect the latest findings and prioritize protecting high-risk populations. During a meeting hosted by CDRAP's Vaccine Integrity Project, experts reviewed current research on COVID-19 vaccinations and concluded that AAP's guidance aligns with the science. Other medical societies will soon follow suit, predicted Michael Osterholm, CDRAP's director, emphasizing that Americans deserve reliable, expert-driven advice on immunizations. So, where does this leave concerned parents? Should they side with the AAP's proactive stance or lean toward the cautious approach advocated by Secretary Kennedy? Is it possible to strike a balance between protecting individual children and respecting parental autonomy? These are vital questions worth discussing, and we'd love to hear your thoughts. Do you agree with the AAP's recommendations, or do you think the focus should shift to other vaccines? Share your opinions in the comments below.